You may have seen my next guest this morning here on Jersey Magazine on the Today Show or perhaps CNN, Fox News. Dr. Jen Caudle is a board certified family medicine physician. Welcome to Jersey Magazine, Dr. Caudle.
Thank you. Thanks for having me.
September is, as you know, National Atrial Fibrillation. That's a big mouthful to say, a month, awareness month. For listeners, Dr. Caudle, exactly what is AFib?
Yeah, so atrial fibrillation, yes, it is a mouthful. We call it AFib for short. Atrial fibrillation is basically a heart abnormality. It has to do with the conduction of the electricity in the heart, and it causes the heart to beat irregularly. Okay, so instead of regular heartbeats, ba-boom, ba-boom, boom, oftentimes you get ba-boom, 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 ba-boom. It's irregular, it's erratic, and sometimes it's even fast. The thing about atrial fibrillation and why there's this awareness month, why I'm working with Omron Healthcare to raise awareness, is because if you have atrial fibrillation, it can increase your risk of stroke by 5 times. That's a big deal. There's a lot of misconceptions. I know we'll talk about it, a lot of things people don't know, but this is really why we're here talking about atrial fibrillation, because it's important to be aware of it.
How does it differ from something as simple as simple, I don't know if that's the right word, but something like tachycardia?
Oh, that's a great question. Okay, I love this. Okay, so tachycardia is a general term that we use to describe the speed. Okay, so first of all, tachycardia is different than atrial fibrillation. Atrial fibrillation is a particular diagnosis of a rhythm. Tachycardia has to do with speed. So you can be in a number of different rhythms and be tachycardic, which means your heart rate is fast. It's just fast. That's what tachycardia means. It's just fast. So when we talk about people with atrial fibrillation, it means their heart is beating irregularly. We're not talking about speed there. We're just talking about the interval. Is it regular? Is it not? And it's irregular. But people with AFib can also be tachycardic. They can have atrial fibrillation that is very fast. So I hope that makes sense. You can be tachycardic and have a lot of underlying rhythms, okay, that make you that. So I hope that's helpful.
It does. And the reason I asked you is I was born with a congenital condition, Wolff-Parkinson-White syndrome. And
WPW, yep.
exactly. Ultimately had it treated by not one, but 2 catheter ablations. The first one was so much fun. I
Oh.
thought I'd go back for seconds. And I actually went into AFib on the table during the
Mm.
second procedure. And I had always been under the impression I knew that I had tachycardia because of the increased heartbeat, but I also thought that it was AFib when in fact it really wasn't at the time until, again,
No,
as I mentioned to
no.
you, it was on the table.
Right. Yeah, no, you're exactly right. So that's a great example of how tachycardia is not the same as AFib, and AFib is not the same as tachycardia, although you can have both, right? But they're not exactly the same. And, sometimes when people undergo heart procedures, it can trigger, or other things, can trigger what we call arrhythmias, irregular rhythms, which it sounds like that might have happened. Of course, I'm not a cardiologist. I'm a family doctor. So let me stay in my lane. But as a family doctor speaking who diagnoses or picks up these heart conditions, reads EKGs, I'm not a cardiologist and not yours. That is my 2 cents. So
Um, thinking about all this and what I had as a kid and what have you, how common are or is AFib?
yeah, yeah. So it's becoming even more common. A lot of people have AFib, probably even more than you might know or understand. Some of the risk factors for atrial fibrillation, one of them includes age. As we get older, the risk for this rhythm abnormality gets higher. Okay, so over the age of 40, our risk gets higher. There are other risk factors as well that will make it more likely, right? So high blood pressure is a risk factor for atrial fibrillation. Alcohol consumption, family history, underlying heart disease, sleep apnea, even, which is it's a reason why we should be treating sleep apnea. But these are risk factors for atrial fibrillation. And as I mentioned, the frequency and the number of people who have it is growing. What that means as well is that the people who are potentially at this increased risk of stroke, because again, one of the big concerns with AFib is that you throw a clot and it goes to your brain and you have a stroke. Okay, and I mean, I feel like we can talk a little shop, because I feel like you have a good sense of heart stuff, probably from your personal experience. But when you have atrial fibrillation and your heart is not beating bump bump boom, boom. That's regular. Boom, just clocking away, right? When it's irregular and it's going boom, 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 boom. When it's irregular like that in AFib, that sort of irregularity can predispose clots to form in the heart. So that's why we don't like the irregularities, because clots can actually form and then be thrown to different places. And one of the places that clots can be thrown to is your brain, which can lead to stroke. And that's what the connection is between atrial fibrillation and stroke. So it's one of the reasons, one of the many reasons why we care about this, is because it's a leading risk factor for stroke.
My understanding is that many people who have atrial fibrillation are asymptomatic.
Yeah.
So
No, you're so right.
if that's the
Yeah.
case, how many people are walking around like a time bomb, if you will, a human time bomb?
Well, yeah, I mean, I guess when you when you put it like that, I mean, I'm kind of like, huh. Well, so what I will say is that, first of all, for people who have atrial fibrillation with proper treatment and management, I do want people to understand you can live a very happy, healthy life with AFib, okay? But to your point, there are a lot of people who probably don't have a diagnosis, okay? How do we diagnose this? How would we even find it? That's what your question is. Well, a couple of different ways. Number one, incidentally, meaning we weren't looking for it. Maybe you come in for your yearly physical, or you come in for a sore throat. Your doctor listens to your heart and says, "Ooh, that sounds a little irregular. Let me get an EKG and see." They do an EKG and they say, "Oh gosh, you have AFib." So we can oftentimes, I probably find it 2, 3 times a year incidentally like that. Somebody comes in for a sprained ankle or something else, and I always listen to heart and lungs, no matter what I'm doing. Always listen to heart and lungs. And yeah, I find I'm like, well, we had something else we got to deal with. So incidentally, that's how it's found. But the other way you asked about symptoms is, yeah, you can have symptoms. That is fatigue, shortness of breath, feelings of palpitations, feeling tired, feeling, sometimes people get jittery or anxious feeling. I'm trying to think, lightheaded dizziness, those can be symptoms. But understand, not everybody with AFib has symptoms, okay? So you're right, it can be tough. And then to top that off, okay, since we're talking shop, and I feel like we're getting into the weeds here, which I love, and I'm so glad I can do that with you. But the thing about it is, AFib sometimes is all the time in people, which means it's easier to find. And in some other people, it just comes and goes, which means we could miss it. Right? So I'm not going to say it's always the easiest to find. What I am going to say, though, is make sure you see your doctor regularly for checkups so that we can sort of have that once over with your heart. And the other part is listening to your body. If something doesn't feel right, make sure you're getting checked out.
I mentioned to you that I'd had two catheter ablations, and during the course of one of
Yeah.
them, speaking with one of the doctors, he said to me, everybody has skipped beats. And you just, oh, okay, that felt a little weird. And you go on with your day. He said, in my case, if you have a skip beat, you're going, whoa, what just happened here? So, when is something like that, a skipped beat, that sort of irregularity, if you will, when does that become a bit of an alarm for someone?
So this is what I would say. If it alarms you, then it may very well alarm me as a physician, because you're right. Your point is exactly right. You're saying, well, how do you know if the skip beat is a bad one or an okay one, right? And this is where you really got to, as a patient, as your listeners who are listening and driving, whatever they're doing this day, this is where I always tell my patients, trust your gut. If you're worried, then chances are I'm going to be worried. And if you're worried, then it needs to be checked out. And remember, it's okay for it to be checked out and for it to be normal. That's actually what we want to happen if something's going to happen, right? But the idea is, if you're concerned, get it checked out, because this is the thing, honestly. Remember, everybody has a range of potential symptoms. Some people have really nothing at all with AFib. Some people have really dramatic symptoms. Some people are in between. Everybody's body is different. And the other thing I'll say too is that, I was talking about, you said, how do you know if you had it? That was the last question you asked. And I said, well, number one, see your doctor so that we can be listening. Number two, listen to your body so that you can be listening to your body. The third thing is that there are oftentimes tools that we have at home that may help us, right? So Omron Healthcare, I've been using their blood pressure machines for years, recommending them to my patients, but they now have this device called Complete. And it's not only a blood pressure monitor, but an EKG all in one, which I think is pretty amazing. It's for home use. And this is an example of a potential tool that could be used at home in conjunction with your doctor and your healthcare providers, that may enhance your health. So understand, we've got other tools to use too.
Dr. Jen Caudle for WDHA and WMTR listeners who want to learn more about this and you, where can they go?
Yep. Please go to onrodhealthcare.com.
Excellent. And again, September National Atrial Fibrillation Awareness Month. Dr. Jen Caudle, a board-certified family medicine physician. Thank you so much for your time this morning here on Jersey Magazine.
Thanks so much.